Chapter 8, Care of Patients with Cancer. Cancer is the term that is given to a collection of related diseases that are characterized by uncontrolled, abnormal cell growth, and that spreads into the surrounding tissues. The images are normal and malignant skeletal muscle cells. A in the top are the normal muscle cells. You notice how these cells are well differentiated and they're similar in appearance. In the lower image, these are malignant cells. Notice that the skeletal muscle they are not similar. There are different sizes, different shapes. This is an example of rhabdomyosarcoma. When adulthood is reached, most of the body's normal cells only grow and reproduce through mitosis. This is a type of cell division that results in two cells having the same number and the same type of chromosome. These cells are used to replace damaged or dead cells following an illness or an injury. Cancer cells are known as malignant cells because the damage to the cell's deoxyribonucleic acid, or DNA, causes the cells to reproduce in an uncontrolled way, and then they invade other tissues and organs. Cancer cells multiply rapidly and continuously in great numbers and in a disorganized fashion. They grow on top of each other, forming a mass or a tumor. These cancerous cells will continue to grow and expand locally, and then some can break off and travel through the bloodstream or through the lymph tissue to other parts of the body. This process is known as metastasis. The body has different ability to withstand the effects of cancer-causing substances or carcinogens, to mount a healthy immune response, and to repair the DNA. Immunocompetence, or the capability of one's immune system to deal with and handle these foreign cells, whether they are bacterial, viral, or malignant, will decrease as age is the single biggest factor for developing cancer. Cigarette smoking is linked to cancer of the lung and is thought to be linked to esophageal, pancreatic, bladder, and kidney cancer. Immunosuppressive drugs are used to suppress organ transplant rejection, and these are a cause of non-Hodgkin's lymphoma. Synthetic estrogens are linked to a higher incidence of endometrial cancer. Many of the medications used to treat cancer will affect the immune system and can predispose the individual to various other forms of cancer. Through research, it is thought that about 90% of all head and neck cancers are tobacco and alcohol related. The ultraviolet rays of the sun can produce skin cancer. The deterioration of the Earth's ozone layer is causing more ultraviolet rays to reach the Earth than in prior years. This expands the problem. There's a relationship of intense and prolonged exposure to these rays and the production of cancer cells. This was first noted when there was a high incidence of cancer, particularly leukemia, among individuals who pioneered studies of X-rays or worked with radium or uranium. It was later discovered that survivors of atomic blasts at Hiroshima and Nagasaki at the end of World War II experienced unusually high incidences of leukemia. Radon gas is colorless and odorless, and it's found within the decay of radioactive materials within rocks and soil. Viruses are capable of introducing new genetic material into a normal cell and then transforming it into a malignant cell. Damage caused by viruses also reduces the body's ability to fight off cancer-causing viruses like human papillomavirus or HPV. Some cancer, like Kaposi's sarcoma, are only seen in HIV-infected or severely immunocompromised patients. There is believed to be a genetic predisposition between individuals and having cancer. Researchers have found that specific populations may have a higher risk for certain types of cancer. With the Human Genome Project, this is finding tumor markers or genetic markers or oncogenes or cancer genes. Predisposition means that statistically certain types of cancer strike a certain age, sex, or racial group more frequently than others. Obesity is strongly associated with the development of several forms of cancer, including cancer of the pancreas, breast, esophagus, kidney, and endometrium. Common cancer-promoting factors include obesity, insulin resistance, and inflammation in individuals with type 2 diabetes. Staging system for cancer: T1, N0, M0. This means that the tumor is small and localized, meaning there is no involvement of regional lymph nodes and there's no metastasis. T1, M, N2, M1. This indicates a small T1 tumor with a moderate regional involvement, N2, that has metastasized, M1, to one distant site or organ. It has been found that eating healthy diet and using exercise can help decrease the risk of cancers. Older individuals have a higher risk for developing cancer. Their immune system is not as efficient as that of a younger individual. Many cancer screening programs are suggested to begin at age 40 or age 50. A biopsy is the removal of living cells to examine them under a microscope. X-ray films may be the first procedure to examine the body for cancer. X-rays can be helpful in visualizing bone and hollow organ tumors. An endoscope is an instrument that is used for direct visualization of an internal body part. It is designed so that it can be inserted and passed along the interior of hollow organs or cavities. Chemotherapy may be used as an assisted treatment after surgical removal of a tumor. The methods of treatment for cancer are chosen after consideration of many factors, and they're inscribed with the best intent of the patient in mind. Surgery will be done depending on the type as well as the extent of the tumor within the individual. Radiation therapy uses high-energy radiation from gamma rays or ionizing radiation beams. As part of cancer treatment, radiation therapy is used to control or kill malignant cells, to prevent tumor recurrence, or to relieve symptoms of pain or discomfort. The radiation source needs to come into direct contact with the tumor tissue for a specified time. Many implants will emit a low level of radiation while in constant contact with the tumor cells. Because radiation source is in the patient, radiation is emitted for a period of time and can be hazardous to others around the patient. Nurses that care for patients receiving internal radiation need to take extra precautions. Depending on the amount of radiation that the patient has had, will determine the distance that the nurse needs to stay away from the patient, as well as the amount of time that the nurse is in contact with the patient. In helping a 40-year-old patient cope with breast cancer, the nurse should help the patient focus on which aspect of radiation therapy and care: complying with scheduled radiation therapies, taking precautions on exposing other family members, protecting the skin by applying lotion, wearing snug-fitting clothing, understanding the therapeutic effects and side effects. The answer is 1 and 5. Chemotherapy may be given before surgery to shrink a tumor, or it can be used after therapy. Chemotherapy may also be used with other treatments, such as immunotherapy. Some chemotherapy drugs are available in oral form to be taken by mouth, depending on the type of tumor that the patient has. Chemotherapy is to be administered only by registered nurses who have completed an approved chemotherapy program and have demonstrated compliance in administering these agents. The licensed practical or vocational nurse does not administer chemotherapy in the scope of their practice. However, they do have responsibility for monitoring the patient during chemotherapy administration. The toxicity that is associated with chemotherapy is evident in the cells of the body that have a short lifespan and therefore needs to be continuously replaced to provide the body with the normal cells that it requires. These types of cells include blood cells, hair follicles, epithelial cells of the mucous membranes lining the digestive tract. Examples of hormones that will be used for therapy might be tamoxifen or aromatase inhibitors. These have been shown to be chemopreventive for women with high risk factors and for reoccurrence for certain types of breast cancer. Biologic response modifiers. These are agents that manipulate the immune system, hoping of controlling or curing the malignancy with little or no toxic effect on normal cells. Interleukins help the immune system cells recognize and destroy abnormal cells. Interferons slow cell division in cancerous cells, stimulate natural killer cells, delay the appearance of oncogenes, and assist cancer cells to revert to more normal cells. Monoclonal antibodies are manufactured using genetic engineering to make antibodies against certain forms of cancer. The monoclonal antibodies work by binding to the antigens on the surface of the tumor to prevent the cancer from growing and dividing. Targeted therapies are a newer form of cancer treatment to block the growth and spread of cancer by interfering with specific cellular growth pathways that are involved in both the growth and reproduction of cancer cells. Bone marrow transplant is mainly used to correct the severe bone marrow damage that's caused by chemotherapy or radiation. Stem cells may be transplanted to overcome the devastating effects of chemotherapy or total body irradiation before biologic response modifiers are used. There are various side effects of an individual that has cancer. Oftentimes, the individual will lose their appetite, they will have weight loss, they will have nausea, vomiting, can be diarrhea or constipation. They may lose their hair. They may have pain. They may be tired and have fatigue. Many cancer patients experience an alteration in taste that is due to cancer progression or cancer treatment. The patient with anorexia may experience a significant weight loss of 2 or more pounds a week, and they may suffer from severe malnutrition. Patients that undergo chemotherapy may experience mucocystitis or sores in the mouth that can extend through the entire GI tract. Stomatitis is an inflammation reaction in the mouth. Both can result in pain and interfere with eating and swallowing. Many cancer drugs are emetogenic, meaning that they will induce vomiting. Nausea will often persist even when vomiting is controlled. Chemotherapy-induced nausea and vomiting may persist for 1 to 2 days after chemotherapy is given. When the patient stops taking the drugs, the nurse should teach them to start retaking the drugs at the first sign of nausea to prevent it from becoming uncontrollable. The nurse should teach the patient to avoid high-fiber foods that encourage rapid evacuation from the bowel and to add low-fiber foods like bananas and cheese to their diet. Cleansing the rectal area and applying petroleum jelly, A&D ointment, or Desitin cream will help decrease discomfort and protect the skin from breakdown. Increasing fluids as permitted, adding fiber to the diet, administering stool softeners and fiber laxatives, exercise, and monitoring vigilantly for the beginning signs of constipation are the routine measures that are taken. The amount of bone marrow suppression is related to the dose given. Severe suppression of bone marrow is a life-threatening side effect for the patient. The nurse needs to ensure that they explain the signs and symptoms necessary to the patient so that the patient will understand when they need to contact their physician. Hyperuricemia, this is caused by an antimetabolite destruction of cancerous cells. Cancer-related fatigue is a distressing and persistent feeling of tiredness or exhaustion from either cancer or cancer treatment. It is estimated that 25 to 99% of patients that have cancer have fatigue. This type of fatigue can last long after treatment for the cancer has been completed. Non-pharmacologic recommendations for the treatment of fatigue include increasing physical activity, minimizing bed rest and prolonged naps, maintaining a good balance between energy and activity, minimizing emotional distress, and maintaining activities of daily living. Although some techniques like using ice caps or a tourniquet around the scalp during administration of chemotherapy have been somewhat effective, these are not recommended by oncologists. The reduction of circulation of the drug to the area may prevent the killing of cancer cells that are harbored in the blood or lymph vessel in the scalp and the head. The main factor in pain treatment is to continue to seek a combination of interventions or various treatments until the pain is under control. Pain should be reassessed 15 to 30 minutes after parenteral drug administration and 1 hour after oral medications are provided. Medication doses should be scheduled regularly and around the clock to maintain a therapeutic drug level to prevent pain reoccurrence for the cancer patient. The pain medication used should be known to provide effective pain relief for cancer. Pain control or relief greatly increases the quality of life for the cancer patient. Acupuncture has been validated as being useful to help control cancer pain. By setting aside worries about addiction to opiates, believing the patient's reports of pain and what relieves it, and concentrating on humane treatment of cancer patients, the nurse can be the instrument for helping the patient achieve a pain-free or pain-controlled existence. Adjunctive medications used along with analgesics to help control cancer pain can include steroids, antidepressants, and anti-seizure medication. In combination with analgesics, one or more of these medications may be very effective. A cancer diagnosis brings feelings of fear and anxiety during a time of stress and uncertainty. Patients lack knowledge about the disease and the treatment options. Generally, at diagnosis, the individual fears death, and after treatment, the fear is about the recurrence of the disease. Understanding the disease and treatment options and what will be experienced during each step of the treatment will greatly help to decrease the fear experienced by patients and families. The nurse must consider psychosocial and spiritual care when working with a patient who has cancer because the disease will affect every aspect of the patient's life in some way. An oncologic emergency can happen when a tumor grows so large that it's compromising the function of all the adjacent structures, or when the metabolic process or normal coagulation processes are disrupted. There are 6 oncologic emergencies. The tumor lysis syndrome. This is a rapid release of byproducts from cell destruction from cancer therapy. Hypercalcemia. Calcium level rises above 11 milligrams per deciliter because of bone deterioration and the release of secretion of parathyroid hormone. DIC is caused by an abnormal activation of clot formation. This results in the excessive consumption of platelets. Pericardial effusion and cardiac tamponade. This is the invasion of cancer cells into the pericardial sac, causing fluid secretion into the sac. Spinal cord compression. This is related to metastatic bone, tumor, and collapse, causing impingement of the spinal cord. Superior vena cava syndrome. This occurs in lung cancer when affected lymph nodes block circulation in the vena cava. When any of the emergencies occur, immediate action is needed to prevent severe injury or death. An increasing number of cancer patients are surviving their disease process through control or cure. Cancer is still the second leading cause of death in the United States. Kubler-Ross introduced to the world the stages of grieving and dying when her book on death and dying was published in 1969. Kubler-Ross suggested that people go through several predictable junctures as they learn to adapt to the processes of loss or impending death. Not everyone will go through all the stages, nor do all people go through the stages in any certain order. These 5 stages may be applied to the grieving process when a body function or part is lost, a loved one dies, or one's own death is approaching. Almost all dying patients face various levels of fear, and it may include the unknown, abandonment and loneliness, loss of relationships, loss of experiences in the future, dependency and loss of independence, and pain. The goal of palliative care is to provide comfort to the patient and assist them to maintain quality of life. There are 2 stages of dying. Pre-active, this may take weeks or months. Patients know they're dying and they exhibit the knowledge by withdrawing socially and attempting to put their affairs in order. These patients often will report seeing loved ones who have already died. Patients in the pre-active phase will become restless, have slow wound healing, and begin to have dependent edema. Active only lasts a few days. These individuals will exhibit specific signs in breathing patterns and other bodily functions which indicate that death is imminent. Often the course of treatment for the patient is to choose what to take and also to be allowed to refuse further nourishment. This is called patient-induced intake. End-stage symptom management is comfort care that is provided to the patient at the end of life. Because comfort is the goal of palliative care, administering oral or sublingual medications is the preferred choice. It is important that the nurse remembers that the feeling of dyspnea can be frightening for the patient and family, and aggressive treatment to lessen the discomfort for the patient is important. The death rattle is the ventilatory breathing pattern of the patient. The delirium is an ontaking of hallucinations or an altering of the mental status. A terminally ill woman reminiscing about the good old days becomes increasingly confused and talks of seeing relatives who have died. Which nursing intervention would be appropriate? Discuss the patient's behaviors with the family, force oral fluids, encourage the family to talk to the patient in quiet tones, promote a calm environment, apply physical restraints. The answer is 1, 3, and 4.